Oh.
No, wait. Maybe one. Okay.
No, maybe after 5 minutes we start, I'm gonna come up and close it.
Yeah.
That's okay?
Yeah.
You can give quickly 5 minutes.
Okay. Hi, welcome everyone. We're gonna start in a couple of minutes. Okay, we should start, I think. So, hola a todas y a todos. Welcome everyone to the seminar Pay and Health, the Revolution of Paediatric Healthcare in Mexico with Paulina Pérez-Duarte, which is the first of the CLAREC Whereabouts Seminar Series that we will be running during this long term. But before we start, we would like to first share with you some of the context that's behind this seminar. In 2020, we founded CLAREC, the Cambridge Latin American Research and Education Collective. This was the result of many conversations and lived experiences inspired by the common concern that Latin American students and allies here at the University of Cambridge share during our academic journey, the need of representation and legitimation, and the aim to make visible ideas and current debates within the Latin American context. At the same time, this has been a great opportunity for bringing together researchers working on the region and everyone who's interested in hearing more about it. I don't know if you might have noticed that CLAREC logo shows a colorful Latin America upside down, as you can see here. And this was inspired by the work América Invertida, a drawing by the Uruguayan artist Joaquín Torres Garcia that aimed to challenge traditional frames of thinking. During this year and a half, CLAREC initiatives have sought to go in this direction of diversification, decolonization, and democratization of academia. We are very grateful of the support and interest from the education faculty, from our colleagues, researchers, and friends. So for us, the presence of you today, either in person or online, is highly relevant, and it actually means a lot. So thank you for coming. We've also seen some of our members successfully complete their research project, as well as new members to join. So the Whereabouts Seminar Series is somehow a sign of this. In the 4 sessions that will come during this term, we'll have some CLAREC members that are in the final stages of the research, and some other members that are joining recently the community. They will be sharing their work on what they're passionate about, addressing different countries in Latin America, Mexico, Colombia, Brazil, and Chile. So say that, now I'll leave it to Javiera Marfan, my colleague, Javi, who's co-hosting this session.
Hello, welcome everyone. Well, this is a hybrid presentation. There are over 20 people that are participating in this seminar by Zoom. So thank you, both of those of you who are attending the in-person session and those of you who are joining us remotely. So thank you all for participating today with us. I want to start by saying that this session is being recorded and it will be posted on CLAREC's website. So in the case that you do not feel comfortable with being recorded, we invite you to please turn off your camera. That's perfectly fine. Hybrid sessions also give us the amazing opportunity of widening participation, but it also has some technical difficulties, so please remain with your microphones off during the whole session. After the presentation, there will be an instance for making questions to Paulina, our presenter. You are also invited through all the presentation to post questions and comments in the chat and to discuss with colleagues and other attendants about the topics that Paulina will be presenting. Later, at the Q&A instance of the session, I will invite those of you who posted questions in the chat to make your questions out loud to Paulina and everyone. So I will present Paulina now. Paulina Pérez-Duarte is originally from Mexico City. She is a clinical pediatrician holding a master's in medical anthropology, and she's currently a first-year PhD student at the University of Cambridge and a member of CLAREC. She will present to us her research project, Play and Health, the Revolution of Paediatric Healthcare in Mexico, which focuses on the use of hospital specialized play interventions. Well, during her talk, Paulina will share with us much more about her own professional journey, her previous and ongoing research, and her efforts to share her pro-play mindset with other child healthcare professionals in Mexico and other Spanish-speaking countries. So, Paulina, the seminar is yours.
Thanks. Thank you very much. And I want to thank everybody that is joining right now and those who are watching the recording, and for all the massive and amazing CLAREC team for putting all this together. I'm going to start sharing my slides just so I can check everybody can see my slides now. Yeah? Okay. So I'm just gonna start sharing a little bit of my stories and why is a clinical pediatrician in the Faculty of Education and why am I researching play and health. So I'm going to take you through a trip and a complete journey through the first Play in Hospital Awareness Week in Mexico. This is an event that I organized to share my pro-play mindset, and you're going to learn a lot of details of what it's all this about. One of the things you need to know is the acronym of the Play in Hospital Awareness Week is Semana Gym or Gym Week. So I'm going to be referring to this event as such. So you have to be aware of what it means. It's the acronym of Juego Intrahospitalario in Mexico, Play in Hospital in Mexico. So it's a complete event. I call it that it's a revolution because I like sharing this with other physicians, with other healthcare workers, people in education, or whoever wants to join this to spread the word and to create more awareness about the importance of play in hospital. So I hope you like this revolution and that we can start working together and see what ideas are inspired after this talk. And I'll be more than happy to learn about that. Now, one of the things that I always share is that I was born in Mexico City, and that makes me think immediately where, like the people in the classroom, where are you from? So Javiera is going to make us, is going to share with us in the chat box the link that you're going to need to access this poll. It's just an easy way to ask questions in real time so we can see what's happening. I'm just going to check that this is working because last presentation I did, I had a little bit of trouble with it being activated. Can you see it in your phones? I don't know if you can see it. If you
do, was shared.
Okay, if you can check, thank you. If you can check and you can click.
It's not on, Paulina.
Yeah, I'm just gonna check. Yeah, it's activated on the app, but I'm just gonna check. It takes a little bit of time. Let me just go into the polls, everyone, because sometimes that's the. Just give me a sec. One of the questions that I ask here, and why I always ask, like, where are you from? I don't ask where are you from, because many people are like, well, I'm from many places, or where do you live? Well, I'm a little bit nomadic, and I'm a little bit of everywhere. Let me just stop sharing this so I can check that this is activated. and I'll be back. I'm so sorry for this because I'm having a little bit of trouble with the app. So I asked, that's why I ask, where were you born? Because that never changes. That's always constant. So I really want to know, where were you born? And also I'm going to ask, what's your field of practice, or where do you work and where do you study? And if I can't make this work, then we're just going to skip the surveys. Dun, dun, dun. Okay, I can't activate this. So I'm just going to skip the surveys. I'm having technical troubles with this. So yeah, I'm just going to keep going. Dun, dun, dun. I'm sorry. Okay. So the next question that I wanted to know is, in which field are you working? Like, are you in education? Are you in anthropology? In any other social sciences? If you can answer if you can answer in the chat box, that will be just useful, so we know and everybody can read a little bit of where are you from and what are you doing. I would love to hear that. So I'm just gonna keep moving forward with this while I see if I can manage to fix this app. But one of the things that you need to know is why, and I'm going to tell you, like, once upon a time, why Paulina changed or drifted from clinical pediatrics to medical anthropology and ended up in play and researching play and health. So when I was in med school, I was very interested and I was very passionate about how we interact with our patients according to our social and cultural backgrounds. I was working in different settings, in rural settings, and I started becoming very passionate about the doctor-patient relationship and how we communicate with patients and how we don't communicate with patients. But when I started pediatrics, it was way more passionate, and for me, it was more interesting to see how we interact with children. But what I call the watershed moment of my career when I was in pediatrics, it was specifically attached to one of my patients. I apologize because this story is not an easy story, and some people might cringe or don't like this, but it happened when I was doing a month working in an intensive care burns unit. And we had a 12-year-old patient who had very severe burns. And because of these burns, he needed to go through a double amputation. So when my shift started, I arrived to hospital and I asked the family if they told the patient that he was going to be amputated. He was already taken to the operating room, and the family and the nurses told me that they didn't say anything to the patient. And for me, that was very shocking. So I ran to the operating room and I asked the surgeon and I say, "Doctor, did you tell the patient?" And his answer was, "That is not my job nor my responsibility." And for me, that was something very important because I waited for the patient to come back. And I was like, okay, I'm going to explain to the patient what happened to him and why he got a double amputation. But then I realized I had no idea how to do this. Like, I had no idea how to do that and how to explain things. And I was this close to graduation. And all that frustration, little by little, started leading me towards a career in medical anthropology. And all the time, I was very, very aware of the lived experiences of patients instead of the biological dysfunctions and how they work and how they don't work. So that started shifting my career. For some of you, maybe you'll be like, medical anthropology, what? Like, what is that? I get that a lot when I say I have a master's in medical anthropology. Immediately I get like, so mummies, bones, like, what is that? So just a quick overview is when you approach healthcare from a social and cultural perspective, is how we see ourselves surrounded by our environment. How social and cultural aspects shape the way we relate with healthcare or with our well-being. And this is important, or if you need an example, there's COVID. I was doing the master's when the pandemic started and we were like, oh no, this is a practical joke, because we started learning how different countries were facing the same problem. So this is medical anthropology. And as you can imagine, I was full of questions. I wanted to resolve so many things and I had so many questions. And I did a diploma in my national university in Mexico. And the professors were like, you know what, Paulina, you have too many questions. So if you're going to do the master's, you have to go somewhere else because we don't have the questions that we don't have these answers. So go find somewhere that you can find this. So after a massive search, I found a program in London, in the University College London, that it's targeted mainly for physicians and for healthcare workers. So here, Paulina was in London to 2019, and I started reading a lot about how children understand what happens to them. And these two wonderful books, one is from 1994, the other one is from 1978, two medical anthropologists that were digging into the use of play and the use of imagination and how chronically ill children start understanding through social construction what happens to them. And in one of the talks I had with one of my classmates, I told her, well, I'm reading about play and about imagination. And she told me, have you heard about the health play specialists? And for me, it was like, have you heard about what? So I think the app is working now. I'm guessing my brother was helping, but please, if you can go into your phones, you might be able to see the question. I can see that it's working. So I want to know if you have heard before about Hospital Specialized play, because it's something that now I say, this is what I do for the living. This is my research. And many times it's like, I have no idea. So if you can please go into your browsers, phones, and anything. Okay, we're just gonna give a couple of time. And if we have time at the end, I'll just go back and see if you can respond to the maps and all that. It will be amazing to know that. Okay, many times when I ask, like, have you heard about Hospital Specialized play? I might need to add this, that it wasn't from me, like that I was not like talking about this all the time. I might add that in my next conferences. Okay, we're gonna keep moving. So I like that in this, it's like not 50-50, of course, but it's like, maybe not. So there's a lot that we need to learn. Basic thing you need to learn is that health play specialists are healthcare workers here in the United Kingdom, that they have three main tasks. One is to provide information for children. So they explain and provide all these things they need to know. Sorry, the second one is to normalize the presence of play. That, of course, is very important because it's not normal. It's not something common. So it's very, very important to normalize the presence of play, and also to provide emotional support. So these are like the three key things that play specialists do. They have different names around the world, but we're going to focus on play specialists since we're talking from the professionals here in the UK. And that shaped my profession, my research. My master's research was how to explain chronic illnesses to children according to health play specialists in the United Kingdom. And when I finished my research, then after submitting my dissertation, I started doing a little bit of everything. And I submitted my paper 1 year ago that I really hope the peer review finalizes one day and I'm able to publish my results. But while I was waiting, because I can't sit still and I just couldn't wait until the paper comes out, I started doing a lot of public speaking. And I started talking in many places. And one of the many conferences, for example, when I spoke for the staff of the Children's Hospital of Copenhagen, then an organization called Paediatric Potential find about me, and they invite me to join as their director of development. Paediatric Potential is an NGO that is registered in the US, but we work around the world trying bringing psychosocial care and promoting this pro-play mindset around the world and in different settings. So because I've been working with Paediatric Potential for over a year, I was invited to be part of a roundtable organized by Il Porto dei Piccoli. Il Porto dei Piccoli is another NGO that works in Italy promoting specialized play. And they make like this meeting of, I loved it because it's like experts in play and health. And there was Paulina in the table. I was very, very excited to be there. But one of the things that happened is that we started talking about what's going on with play around the world. And I told them I've been speaking in the Play in Hospital Awareness Week of the United Kingdom, and the Play in Hospital Awareness Week in Australia, and the Play in Hospital Awareness Week in New Zealand. So we started talking about, why don't we have a Play in Hospital Awareness Week international? And for me, it was like, yes, we need an international Play in Hospital Week. But then I said, wait, there's nothing in Mexico. And then I realized I was the only Spanish speaker in the table. And I was the only Latin American. And I was, of course, the only Mexican. So I thought, well, we have to do this in Spanish. And then it hit me that I was like, if someone's going to do it, it has to be me. Because if I'm the only Spanish speaker here, that means that it's my call. So that led towards the first playing hospital, or the gym week that I've been talking about. So now I'm going to share a little bit with you of what is this Playing Hospital Awareness Week, now that I share all this massive story with you. So it was a virtual space for Spanish-speaking students that are child healthcare professionals who wanted to learn what's a hospital specialized play, to change or acquire and inspire more people to have a pro-play mindset. And I also wanted to build a network, because we are everywhere. Like, there's someone in Brazil doing this, although they speak Portuguese, but they joined because they speak Spanish as well. And there's people in Ecuador and in Spain, there's people everywhere, but we don't talk to each other. So one of the main objectives was also to bring this network and to invite more people to join. Of course, I'm a clinician. I worked 10 years in an emergency department, so I have no idea how to do these things. So I have Ernesto, Dr. E. He's one of my friends from college, but he also drifted from the clinical world into marketing and personal branding and internet and social media presence for physicians. So he told me, I can help you to push this, and we started working. We've been working together since April. And we started shaping, and he taught me how to use New Cellular, and he was all the strategy and the marketing, and he helped me through all this process to create the concept. Now, when the concept was created, I pitched all the idea to Daniela. She's the logo designer, a visual communicator, an illustrator, and yes, we are related. And I told her, this is my idea, and she put my idea into beautiful colors, so I just needed to choose which logo I wanted. So once we had that, I had to jump into creating the website, designing the program, and then doing what I promised I was never going to do, social media, to start getting more people into the project and learn how to use it. So what happened with the Playing Hospital in the Playing Hospital Awareness Week? Well, with Gym Week, we had 64 people participating. 44 of them were students. We had people cheering. We had people speaking. We had also people that donated scholarships. So I could pay for the platform, and I could pay for the basic expenses that this was creating. And people who donated that didn't speak Spanish, but they were like, you know what, I'll pay an entrance and invite someone that might find this useful. And of course, my dad is always in my conferences. So hello, Dad. Thanks for joining again. And this is the map of all the people who joined. And what happened is that in these 44 students, I'm just going to share, we had people from 8 different countries that were spread across mainly Latin America and Spain. And of course, Mexico City being the main target, and also because it's the people that know who I am. So many of them from Mexico City, where I'm from, started joining. So these students, about the professional backgrounds, before we started, I asked them to see what was like the profile of my students. And many of them were like pediatric special, like they have a pediatric specialty. One of the things that the specialty that was most common was cardiology, but this is because Lilo Foundation, it's an organization that helps children with cardiac problems. They were supporting at all times. So that's why they were paying for the entries for their doctors, and they were promoting a lot. That's why we have so many cardiologists. But the second one is the intensive care unit doctors. So I'm very curious, and I think there's a very interesting thing why intensive care unit doctors were dragged or were attracted by Playing Hospital, by the Gym Week. I asked them how did they find out, mainly because of Fundación Lilo, maybe because I was like nagging everybody to join my event, and also the University of Barcelona, one of the professors joined as a speaker, so she also invited some of her students. And one of the things that got people's attention was that it was mainly in Spanish, and because they were willing to change the way they interact and they provide medical healthcare, and they wanted these new approaches and these new ideas to jump into clinical settings. So after all this, I'm going to share what we saw, because like a Gym Week, yes, but what was Paulina preaching about? So the first day, it was me as a speaker, and it was the power of play and the role of health play specialists around the world. So what we talked about is like the research that has been done, and there's Paul Ramchandani, he's my supervisor at my PhD research supervisor, and this amazing paper that was created by many of the doctors that work in Denmark, and this is a literature review on all the play interventions and what's happening around the world regarding play. They have done this amazing category, which I'm going to be following during my PhD research. And one of the conclusions that they have after this massive lit review, is that we need to get children's opinion, and we need to get what people like, what children have to say. We have to share with them, like to listen to what they want to change, what they enjoy, what they don't enjoy. So that's a little bit of my PhD. I'll tell you a little bit more. Now, I'm also going, I also share with them that there's literature in Spanish, and I'm going to talk about Ana a little bit later, and explain during the first day that play specialists they have different names all over the world. In some countries, like in the US, they are called child life specialists. In Australia, they are called child life therapists, and all these different things. So, and also make the difference, play therapy, the play therapists, they are psychologists helping children who are going through certain problems through play, which is different from hospital specialized play and health play specialist. So there's a difference, and I just want you to know that, because it tends to be very confusing. And I told them the basics that they needed to know about play specialists, and we started a tour around the world of what's happening everywhere that I am aware of, and all the emails and all the contacts that I've been doing. For today, I'm just going to share with you what's happening in the United Kingdom, since we're in Cambridge. And the thing is, in the United Kingdom, the National Association of Health Play Specialists and the Play Specialists Student Trust merge into the Society of Health Play Specialists. All the play specialists they have in the United Kingdom, last time I checked, it was 650 certified play specialists, and they are supported by Starlight Foundation, who are pushing play in hospital and who are supporting everything they're doing at the moment. And also, I have to say that in the UK, I registered myself there because what am I doing is researching about play and sharing all I can do and all I'm doing through social media with my students. And one of the things that I really wanted is to get them all pumped and getting all excited about what it's play in hospital, and that led us to day 2. During day 2, because I didn't want to make them sick of my voice, and because also I don't know in everything, I invited 2 very important people that we have in the field in Mexico. One of them is Maria Fernanda Busqueta. She's the only child life specialist we have so far in Mexico. She's a psychologist, and I asked her, can you please help us to bring your pro-play mindset and bring everything you know about families and and how to care for the family unit. One of the things she taught us is that families are not visiting, and it's not like, oh, your brother came to visit. It's not a visit. It's part of the family unit, and we as healthcare workers have to care for all of them. Antonio Rizzoli, he's a neurologist. We did the residency together. I was in pediatrics, he was in neurology. He's specialized in neurodevelopment, and he's working also with the Lego Foundation in Mexico. And he was teaching us how to interact with our patients digitally, how to be friendly, how to, even though if we're talking with the parents, how to incorporate children into the conversation, how to make pediatrics fun, even in the digital era. So that led us to day 3. Personally, day 3 was a little bit heavy for me because the topic was play at the end of life, and if we should inform terminally ill children they are dying. This topic was it's a taboo topic, and it's not easy to talk about this, but that's why I wanted to put it into the mix of play in hospital. We talked about elderly care, and I gave an example that in Seattle, I don't know if you have heard of this, but there's a nursing home with 400 people, who are older, and they're living in this nursing home. And some brilliant person said, you know what, let's put a preschool inside the nursing home. So you can just imagine what happened in that nursing home and how play got incorporated into the lives of all these people. So we talk a little bit about that. If you want more information, there's this beautiful documentary that's called Present Perfect that talks about that nursing home. And I also share a little bit of the projects that Dr. Carrie Ryan is leading in UCL. Dr. Carrie Ryan was my supervisor during my master's, and both of us, we were doing a lot of research regarding regarding end-of-life care. And when we started researching a little bit more about play, and we were like, you know what, this is what we have in common. So she's leading the project of Aging Playfully in UCL. With this, we started talking a little bit about hospice care and what like the structure that the NHS has in this country to care for children who have diagnoses that are terminal diagnosis, and how can we share all this. So this is a little bit of the hospices that are around the UK and the beautiful thing that they do and how they incorporate play into the end of life care of children around the UK. Javier is going to help us and she's going to share. I'm just doing a quick fundraising for this organization since it's part of the half marathon and all that stuff. So she's just going to share. If any of you can help me with the fundraising, I'll be more than happy, and that will be in the chat. So during day 3, I share with them a lot of what I learned in one of my classes and in anthropology, that it's Anthropology of Death. It was a very interesting class when I started reading a lot about death and dying and about how we care for children who are, and in this part of life, where is the end, but it's not supposed to be the end, but we struggle to talk about it. And it's very interesting. And that's what I say, it's hard to talk about, it's hard to write about, it's very hard to be reading about that through the winter. But these are 2 of the articles that I wrote regarding death and dying. So I'll share the links later if you want, but those are the titles of the articles that I wrote during that period. So now we're going to day 4. During day 4, what I shared was mainly the results of my research. I shared with them that I interviewed 12 play specialists, that I wanted to know everything about them. And I also had to explain a lot about what is qualitative research, because in the biomedical world, we are very quantitative. So I had to walk them through a little bit, because when you say qualitative, it's just like, so yeah, you ask people questions and then what? So I wanted to share with them a little bit of what qualitative research is. I shared the 10 main findings that I got from my own research, and I want you to pay attention mainly in this, the ninth point of my research findings. It's medical training, and that's what I'm doing in the Play in Hospital Week. I'm sharing that this properly mindset needs to be put into the biomedical curriculum to teach medical students that this is a thing, that this exists, and that this can improve the life of many, many children and their families. And now we're almost there, day 5. In that day, I had wonderful women that I invited, these 3 rock stars that are from different universities from Spain. So I'm just going to share a little bit about them. Verena Del Valle, she's from Barcelona. She studied in the University of Barcelona. She did psychology. Then she went to the US to become a child life specialist. And now she lives in Switzerland. She works in Hospital de l'Enfance in Lausanne, Switzerland. And she shared with us a little bit of her every day, how she finds the room like this when she arrives to her office or to the hospital, and how she transforms this space and makes it child friendly, and how she creates these little changes to improve the experience of children. Carmen Jerez, she's a nurse, and she has a PhD in anthropology, and she's a professor at the University of Barcelona. She's the director of the Child Life Master's program in Barcelona. So she's leading the information there and how to share this properly mindset in Barcelona. And she was talking to us, and she shared a lot about how important it is to make more humane and more friendly what we do for children in hospital. And Ana Ullan, she is a professor from the University of Salamanca, and she recently published this book. It's called The Humanization of the Pediatric Hospital. And she talked with us a lot about her research, about each one of the chapters of her book. It's an amazing book, but it's all in Spanish, which also makes it wonderful for my audience. And it was very nice because some of the students, they even bought the book before Gym Week. So we really, really, really enjoy her talk. And for day 6, what I wanted to wrap up the Play in Hospital Week, I wanted to share with them the obstacles, the challenges, and the future. So I invited Tomás Lobez. He's not in healthcare. He is a designer, and he is a social entrepreneur. And what Tomás created was Nixie. So Nixie is a beautiful, beautiful project that it's virtual reality, but it's not used to distract children while they are going through a procedure. What Nixie for Children is that Nixie, the little character with blue hair, Nixie guides the children around the hospital, around what the radiotherapy is going to be, how the surgery is going to be, how it's going to be to visit my doctor today. So they can go through virtual reality, take this amazing tour and start learning little by little what is going to happen to prevent anxiety, to prevent like this horror of going to the doctor. So one of the many things that I asked Tomás is to share what happened when you started this project, what happened after that, like the challenges you faced, how did you solve them? Because I wanted to keep like pushing everybody to get moving, just like Tomás did once, and now he has this wonderful thing. I also shared during that day the challenges that face specialists face during their work in hospital, because that's one of the main things that I bumped into my research. So I shared that with them, and that for the future, this thing that I mentioned to you before about this roundtable and the idea of having a plain hospital awareness week, it's something that we have to push forward. And when I shared this, I was talking with Tom, I can't say it. I was talking with Tom, the director of the knowledge in the Faculty of Education. He told me, so what you want is a plain hospital awareness day? I was like, yes. And he's like, so you're doing all this because what you really want is a Google Doodle. And I was like, well, that's a very good idea. So just in case you don't know, this is a Google Doodle, like the little drawings that they put in Google every day. So you remember things that are happening around the world, like the Olympic Games and stuff like that. So now I'm going to share a little bit, I'm aware of the time, but I'm going to share a little bit of what happened with all the students and all the participants that were part of Gym Week. Well, they were sharing a lot in social media. They share how much chocolate they ate during day 3, how they were sharing this with their nurses in the intensive care unit, in social media to increase the awareness. And we started thinking about the future of what we're gonna do in the second Plain Hospital Awareness Week and how we are going to achieve it. Of course, I'm already dreaming and thinking, what am I going to talk about next time and what are we going to use? And they've been asking, can you put more about intensive care? Can we use a comparison of how play works in schools? What happens when you're in prison? Because there's children that grow up in prison because of the condition of their mothers. So how can we mix that? And how can we put play in and compare different institutions and the great power of play? So I'm going to have to keep thinking about this and look for speakers because we need Spanish speakers or we're going to need translators. So it's a very big project. So we're going to have to keep pushing. And so far, there's been invitations from the speakers in Mexico to speak in Barcelona. There's been interactions with Brazil, and there's a lot that has been happening. So I wonder if you now get all pumped, if I manage to share this with you and to put you all hype. I'm all hype and very excited, and I'm Mexican, so I'm very loud. So sorry if I'm getting too excited, but I want to check if the app is working. I just want to know if you want to join this revolution. I hope this works. If not, we're just gonna hope that you do. And I'm gonna keep moving forward because of time. Okay, so I don't think it's working. I'll move. I hope you want to join. And one of the other things that happened after Gym Week, just to share a little bit of what happened, I've been invited to speak at King's College London. So that was this Saturday. I couldn't come because I'm in isolation. But I spoke in front of 40 students, medical students and high school students that are willing or are thinking of a career in healthcare. It was very exciting for me to see that now younger generations are getting a little bit more of what I'm doing. And I'm going to be speaking soon to the University of Barcelona. And after Gym Week, well, of course, and I didn't mention CLAREC because this is what we're doing right now. And one of the things that after Gym Week, I sent a survey for the students to see what happened. And one of the things that I learned is from the 13 responses I got is that they were not alone. When they joined the Plain Hospital Week, they had their nurses, they had their students, some of them, they had like their families or wives. So now I'm aware we had 55 students listening. And I also asked them if they were going to rewatch this, because I said I left everything recorded and I left it like open for them to use it for their classroom, for their students, so we can spread and increase the awareness of this. I asked if they were satisfied, and these are the responses of the overall experience, but each goal I wanted to know, did you learn about specialized play? I wanted to know, did you get inspired to acquire the pro play mindset that we want? And did you manage to improve your network? And this has been, for me, very like fascinating and very I don't know how to say it, but I was very, very, very satisfied of the job I did. And also because I want to keep them, and also because Ernesto is helping me a lot. Dr. Idebon that I mentioned before as my consultant, we're keeping them engaged. So every week I send a semanario, which semana is week and diario is diary, so weekly or something, but once a week I send a tiny newspaper with 3 points, the 3 things you need to know about Plain Hospital this week. So Lego is doing this organization is doing this. The little one here that you can see, she's a researcher in Ecuador, and she told me I stopped writing my dissertation because I was sick of Play and Health, but after Gene Week, she's like, I'm pumped, and she's writing again. So hopefully we're gonna have more people that get engaged and excited about this. Other thing that happened after Plain Hospital Week is that there's been a little bit of fights in one hospital in Mexico. One of our pediatricians, she's a cardiologist, and joined when she learned that one of the patients was going to go through heart surgery, and the people in the security guards, they didn't allow the patient to bring her teddy bear. She went and confronted the security guards because she recognized and she knew how important it was for the patient to bring her teddy bear into the healthcare settings. And Lila Foundation has been working with me and has been sharing with me a lot of these pictures. Intensive care, pediatric care, I can't share the pictures because they are children who are in intensive care and they're not, it's very hard to look at them, but just so you know, patients with lots of cables and lots of things who are being exposed to music, they are being exposed to different types of toys, stories, and they're trying to make more humane and more joyful the time that they spend in hospital. These are other pictures that were sent by Lila Foundation and how they are taking care that all the time there's something playful. If you haven't seen, Batman is there ready to receive a patient for surgery, and they're sharing with us and in their media how they are incorporating play into the hospital. These are other doctors that they share these pictures, and they said, here's the proof that families are not visiting, and how they invite the siblings to measure the head of the baby, to go and hold them, but stop calling them visits and being part of it. And this is very excited, but this is a playroom. So Lila Foundation is preparing this room in Yucatan, in the peninsula of Yucatan, to make a playroom in the cardiology unit of the hospital. So right now they're pushing that. We're gonna try to see if Lego Foundation Mexico or any other organization can help us to build this and improve the situation for children. And of course, what I'm doing about spreading the word and doing all that. And one of the things that maybe many of you are like, and what is she going to talk about her PhD? I wanted you to know all this because now you know why my research is children's perspectives of hospital specialized play interventions. So what am I going to be doing is that I'm going to be working with Impedal, that's where I'm researching now, and I'm going to use all my pediatric background, my anthropology background, and all my research background, and look into children's perspectives. I want to understand what they have to say about this. We adults say it's amazing, that it's beautiful for them, but I want to learn from them what is helping, like how is this helping? So I'm in the second term of the PhD. So many of you already know that I'm already like floating all over the place, but this is where I'm heading to try to understand how can we take this input from pediatric patients to improve what we do, and to see what's the most important thing that I have to go and tell Spanish-speaking countries and countries that don't have funding, to tell them this is the most important thing that we have to care for and that we have to cater for children. So this is going to be what I'm going to be doing during the next 3 years. And going back to the Google Doodle that I mentioned, can you see I can't stay still? So I was like, okay, so I have to wait until someone in San Francisco and someone in Google listens to me and we can have the Google Doodle. So how much am I going to wait? So I just told Daniela, you know what, Daniela, I have this idea. We have to make a Google Doodle. And because she's the illustrator that puts colors in everything that happens through my mind, here you have the exclusive of the first Google Doodle that she already created. So now we have to make it famous. But she already did our International Plain Hospital Awareness Day, and see where we can end up with this to create more and more awareness. So it's been a pleasure for me to share. I hope all my excitement goes through the screen straight to whatever you are at the moment. And thanks to all the team of CLAREC for sharing this space and letting me share what I'm doing. these are some of the, well, it's my website, my email, and the Instagram or Twitter, whatever fits. I post the same thing in both pages. If you need the QR code to follow Pediatrician with Sign, where I post a little bit more about my research, because I know there's a lot of healthcare professionals that don't have the time to look into this, but I know that young people are in Instagram all the time. So that's why I'm sharing. So thank you very much. And I'm gonna just stop talking and open the floor for everybody else.
Thank you very much, Paulina. Now we're going to have some time for questions. So if you have a question, please raise your hand here in the remote session. But if you have a question and you are in the in-person session, then you can ask Rocio to help you with the microphone, so everyone else can hear you from the hybrid, from the remote session. So Rocio, I don't know if they're in the in-person session, there is someone who has any questions for Paulina?
Not at the moment.
At the moment, okay. Professor Ricardo Sabates, he has his hand raised, so I'm going to give you the word.
Thank you, Paulina. And I think I'm just rewinding a little bit when you were designing the week, and I think this was when we last spoke. So first of all, congratulations for making this out, actually for leading this and making it happen. So I have a couple of questions. One is with respect to the sustainability. You're obviously a very, very big driving force of this. So how do you see the sustainability of this without you? So that would be one question. But the other is with respect to your fellow students is how is this helping you to frame your own research? And what are the connections between the Playing Hospital Awareness Week and how you are further thinking about the work that you're doing, and how is that helping you with your thinking? Thank you.
Thank you. Well, yes, I'm very excited because when I shared this with you, I was like, I'm about to start and I don't know what's going to happen. So I'm happy to share that you see what happened after the event. I think the sustainability it's something that I'm been thinking a lot and that I'm actually worried about, because even though it's a project that I started and I've been pushing, I'm aware that because of the PhD, I might not have the time for that. So I've been looking into different ways that I can find funding, because, for example, one of the participants, she told me, I want in, like, I want to participate, I want to help, like, even though if we don't have funding, I just want to be part of this so we can have a second week and a third week and continue it. But I'm aware that I need a team. This is a lot of time and it's a lot of effort. And I sort of have to be able to say, this is going to be the program. I'm going to be speaking here. This is design the content, and then have someone in social media, have someone doing the entrances, the costs and all that, because putting all that on me, it was okay before the PhD. But when the funding for the PhD happened, then I was like, oh, I have a monster here and another one here. So I am worried about the sustainability because I can't do this alone anymore. So I will need funding, and I will need a complete team to push this forward. So yes, and if any of you have any idea, I will be more than happy to hear. And how is this going to push or help into my research or frame my own research? One of the things that in one of the seminars this week, they told us was, you're not filling the gap in anything. Like you're not filling the gap of knowledge. You're just adding into the conversation. And that's what our research, that's what we're doing, adding into the conversation. But the thing with play and health is that conversation, it's just starting, is something that it's growing and it's a little bit. So I'm going to, with my research, adding to the conversation, but I want to create noise. I want everybody to be talking about this. So I think, for example, with Gym Week, I invited the researcher in Ecuador because the professor in Spain told me there's someone in Ecuador, and from Pediatric Potential, they told me there's someone in Brazil. So this network, that when I saw the size of the network and everybody like talking to nobody and feeling alone, I was like, okay, let's start getting together. So that's one of the things that are happening now. If Erika in Ecuador says, I just published this paper, then I tell the network. And then Anna has new information and a new book, then I tell the network. So I want this to add, I know my research is going to be this much of the conversation, but I also want to push this conversation to keep going and to make it bigger and to make it louder. And at the end, I left clinical pediatrics because I want to improve healthcare for more than one kid at a time. I want to create a bigger impact. And I see these silos as little seeds that I hope one day in 30, 40 years, this grows and becomes like the monster that it needs to be for the sake of children. So I hope I replied to your question, Ricardo. Yeah. Karina, I see you have your hand up. Hi.
Thank you so much, and nice to meet you. I am a speech therapist and also a hospital clown, and I'm doing my master's in palliative care in Lisbon. And my research, I'm collecting life stories from the elderly. And for my PhD, hopefully, I'm going to be able to do some storytelling for kids. And I'll be telling them about what is important in life in the oldest perspectives. And what I really want to do in my master's is to work a bit in the legacy that the elderly can just tell to the kids. And as you said, qualitative research has been very challenging for me, and was such a very, very like moment to have you all here and to see that I'm not alone in my research. And yeah, it's amazing. I've been in Tanzania 2 years ago for a clowning around over there in Muhimbili Hospital. And I was there for 6 weeks. And I think I've never felt so lost in my entire clown career, because yeah, I did some training for the staff, but I didn't know, like I was really searching on Google, how can I find people doing play activities in palliative care awards? Because I didn't know anyone but that time. So thank you so much for happening in my life, and thank you all.
Now I'm very happy because I really enjoyed this finding each other. I think I always joke with some of my colleagues, it's like networking is my passion, because I think it's very, very important, because play and health is a lonely road. It's fun and it's amazing, but it's lonely. And you can identify, but when I finished my master's, looking for a job, it's like, so I'm a pediatrician who did medical anthropology and I research play, and who's looking for me? Like there's no institution that says, you know what, we're looking for this. I don't fit. And I think that's what happens a lot with play and health researchers, that those jobs and those opportunities, they are not there yet. Like maybe kids who are 15 now, when they graduate, they're going like, what are you going to do? Oh yeah, play and health, because that's a field. But right now it's not. So it's our job to start this. And I shared my research, amazing conference, but it was 100, and not because it was amazing what I said, the event. It was 120 children, Mexican kids with diabetes. And it was a camp of 120 children in Zoom, and I shared with them my research, but I flipped it. So it's like, if the doctor is not talking to you, maybe the doctor hasn't been able to sleep, maybe they're tired, maybe they are stressed. So wave to the doctor. If the doctor doesn't allow you to ask questions, write them down and give them to the doctor so he can. And these type of things about my research that I teach to medical students, I taught them to the kids. And I think that allowed me to see how maybe one of the girls, I don't know, because she was wearing a coat as a ghost and a glasses like dressed as a ghost. And she asked, how are you going to spread play and health in Mexico if we don't have it? And I was actually, that's my problem, that we don't have it. But I told the kids, you know what? I'm going to be for the next 30 years talking about play and health, so everybody knows that this exists. And when you get to my age, then it's your responsibility to incorporate this into healthcare, because I'm going to be in charge of the awareness and you're going to be in charge of applying this into hospitals. And they were like, yeah. I was like, who wants to work with me? And kids were like, me. So it was very exciting. So I hope this translates into children getting more involved into this. I speak a lot, sorry. Karina, please contact me after this.
Thank you so much.
Thank you
And
very much. I don't know if there are any other questions in the audience for Paulina.
I have a question myself, if that's okay.
Yeah, of course.
Thank you, Paulina, very much for your presentation. Like, it's very new to me, and I think for many of us from the Faculty of Education, as you know. And my question has to do with adultocentric perspectives. We know that these are like part of our everyday lives, not only in health, but also when it comes to other parts of the social life. So my question is, how do you, what are the main challenges with these adultocentric views in your research or in your area? How do you see them?
Well, I completely agree with you, because one of the things, as you say, like, there's no jobs. Like, that's because maybe if children knew about this, they will be like, I'll hire her, because like, that's important for me, but for adults it's not. So one of the, actually in the essay that we just submit, I wrote a paragraph specifically of why is this important for adults and why is this important for children. And one of the many things that I have for adults, it's how play in hospital will prevent further expenses in mental health, and thinking also the attachment for treatment. Because if you have a child that is completely traumatized by the experience in hospital, then it's going to be an adult that has a lump here, and he's like, no, I'm not going to the hospital because I'm not going to the hospital. So that's going to translate into bigger expenses. And one of the other things that in the US, for example, Child Life Specialists are doing a lot of research, and in UCLH, in the University College London Hospital, they are doing a lot, is to prove how preparing children through play prevent the use of, or reduces the use of anesthesia for CT scans, for MRIs, and how these reduce costs, times of waiting, and let's just say the economical benefits of introducing play in hospital. So these are a little bit of the language that we need to use to explain adults why play in hospital is important. And there's a lot that needs to be done, because it's like, is it effective? Like, how can you measure this? Where is the proof? There is no research done. So that's one of the things, like going back to what Ricardo asked, is there is no proof of this, but I'm going to put my little part, and hopefully more people will start putting more and more and more, so we can prove this. And we can, or not prove, but find out. Because one of the things, like, what if my research says children hate this? I really don't think so, but we don't know. We haven't asked this. Like, maybe kids will be like, again. So we have to find out what is this all about. So it's hard, and even for me, I have to share, when I went back to Mexico between the master's and the PhD, I told some of my colleagues, I was like, so I'm researching play, and they're like, play? Like, what are you talking about? Like, but you're a clinician. What do you mean by play? I was like, well, I'm researching play, and it was like this is not important. But as soon as I went, well, but I'm going to Cambridge for a PhD. What do you mean? So play? So how it changed? How it's just like Paulina and the crazy hippie doctor that is researching play, but suddenly she got validated by an institution such as Cambridge. So I think it's going to be adding slowly into the importance and the recognition that we put into this field. I don't know if I replied to your question, Rocio. Yeah.
I also have a question, Paulina. I don't know if there are other hands raised that I can give you the call, but it comes to my attention that you told us about how you feel that you don't fit anymore with your original background that is in science, but now you're a student in a school of social science and humanities. So I would like to know your initial thoughts, of course, because you are still transiting, and I can imagine, from how you can complement this other half of what you're becoming, the anthropologist, the social scientist, from the medical background that you already have.
Well, I was going to say, I think that the big shock that I got was when I jumped into anthropology. Like, when I started the diploma, and I was like, this is interesting, this is what I want to do. Yes, I'm going to do a master's. And when I was in the master's, I was just like, what am I doing? Like, I don't even understand the words. Like, what is qualitative research? I'm going to share later the article I wrote of remodeling a medical brain, thinking anthropologically. Because in that article, it was when I started realizing that I was paying attention to the biological stuff of things. And then with anthropology, it was just like, but that's not what all it is. There's more. So all this process of looking, like stepping back and seeing the same problem from a different lens, it's been such an eye-opening and life-changing experience that I know many physicians won't be able to have. And that's why I went so crazy into the public speaking and into social media and into trying to share and tell them, from all the things I've been learning, please take away this, please take away that, because I know they won't be able to go through all this transformation. And of course, now that I'm in education, many times what happened with my supervisor is that I'm saying, we're going to do this, we're going to do that, I can do this, I can do that. And he's like, okay, that's medicine, that's anthropology, where is education? And I'm like, no. So now I have to put education into this and how we're going to translate my research into medical training. And how are we going to put this into the medical, the curriculum of students that have no more time? Like there's no free time for them. So how am I going to incorporate this? And I compared a little bit of how you teach ethics or bioethics. It's nothing that you have to learn this thing. It's more like the thing that you surround your practice with. You surround your practice with ethics, you surround your practice with play. But there's a saying in med school that they say all the time, the eyes can't see what the mind doesn't know. So how are you going to incorporate play into your clinical practice if you don't know that's an option? Because I was always playful and I was always silly and I was always called to the principal's office because I was blowing bubbles in the emergency department, not with my mouth, with a little machine, health. But I was blowing bubbles and I was just called to the principal's office because I'm not supposed to be doing that because I'm a physician. Why not? I was on the floor with the patients. That's not cool. You shouldn't be in the floor with your patient, but the patient is one. I want to be in the floor with the patient. But now I have the research, I have the background, I have the evidence. So I'm just trying to share this mindset with more clinicians and see how can I reach children through their healthcare professionals. So it's a long process. Sometimes it's painful, sometimes it's very frustrating, but at the end, children is what it's behind everything. I do all this because of the children, so I just keep pushing and keep doing that. So hopefully it will be for them.
Thank you very much. So if there's no more questions for Paulina, I'm going to pass the word to Rocio, that she's going to say the final words of this seminar.
Thank you, Javi, and thank you everyone who has joined us today. As I mentioned at the beginning, this is the first of the Whereabouts Seminar Series. So for the next session, we're going to have Julia Hayes presenting her research on Colombian Escuela Nueva schools and inclusion with children with disabilities. To follow up on the specific dates and times and to register for that seminar and the following that, you can follow us on Twitter, Instagram, and also on our webpage. I don't know if I can put it here. And yes, that's it. Thanks again, Paulina, and thank you, everyone.
Thank you very much.
Bye, everyone. Thank you, Paulina.
See you all.